Year marks the 40th anniversary of Breast Cancer Awareness Month, and the Dana-Farber Cancer Institute is helping with key research here in Boston.
This morning, we are joined by Dr. Adrienne Waks, a clinical researcher with Dana-Farber. Thank you so much for being here with us this morning. This is such an important topic to talk about, and I want to start off by asking you why younger women are increasingly being diagnosed with breast cancer.
It's such a good question. It's one that we don't have all the answers to, I think, even at this point. But we think some of the contributing factors might be that people just in general are living less active lifestyles, more sedentary lifestyles. There's more overweight that we're dealing with. Those are both risk factors for breast cancer. Maybe something environmental, pollution, microplastics, other things we're looking into.
We know that early detection is so important. Can you talk a little bit about some of those guidelines for women?
So yes, within the last year and a half, the major guidelines have all now aligned to recommend that women start their mammograms at age 40. So that was an update compared to previously in a number of years ago. Some guidelines said 40, some said 50, but now they are all aligned, saying that women should start at age 40 in response to what you were bringing up, that we're seeing more and more younger women being diagnosed. So women should be starting at age 40.
Are we seeing any improved treatment options for women?
There, the answer is a resounding yes, and I am so happy to say that, definitely we still need to make more progress. There's lots and lots of work to be done, but absolutely both for women with early stage breast cancer, being able to offer more medications to make sure that they hopefully never have a recurrence of their breast cancer, and for women who have metastatic breast cancer that has spread other places in their bodies, we're seeing many new FDA approvals for new medicines that are improving those patients' outcomes. So yes, lots of progress that has been made, but also more we need to do.
That's really exciting.
Yeah.
A lot of hope. What are some healthy ways that all of us can do more, try harder to just take care of ourselves and reduce our risk?
Yeah, absolutely. I mean, the healthy lifestyle behaviors that sort of lead to good health in general are really the same things that help you reduce your breast cancer risk. So, as I sort of mentioned before, trying to maintain regular physical activity. I always tell people that doesn't mean you have to be like doing some super intense exercise 7 days a week, taking a walk 45 minutes 3 times a week. That is a wonderful form of exercise that will protect you against lots of cancers, including breast cancer. Trying to maintain a generally healthy diet, a healthy body weight, and trying to keep alcohol consumption in minimal or in moderation are some of the important ways you can reduce your risk.
And Dana-Farber is, of course, a leader in cancer research. Can you talk about some of the work that's going on there right now?
I agree. It's a wonderful place. There's so much that's going on at Dana-Farber and across the nation and the world to try to improve breast cancer treatments. I think some of the really exciting areas at Dana-Farber in particular are, trying not just to develop better drugs, which of course we need more effective medicines, but also markers, like what can we measure in somebody's blood, what can we measure in somebody's tumor tissue, to try to figure out how do we match the right treatment to the right person, and not overtreat somebody and not undertreat somebody, but make sure it's sort of just right.
So really customizing that.
Exactly, individualizing, yeah.
Right.
We are so lucky. People come from all over the world. We don't want to need these places, but to have them in our own neighborhood, in our community, is just really such a blessing. So much hope for families during a really scary time.
I totally agree. Absolutely.
All right, Dr. Adrienne Waks, thank you so much for sharing all this important insight with us this morning with our viewers. We'll be right back.